You are now viewing the first installment of a short series on anabolic steroids. I'm your host, the YouTube medical expert, an expert on all things endocrinology, pharmacology, and, of course, anabolic steroids. What are anabolic steroids? Anabolic steroids are an illicit drug that have taken the American people by storm over the past decade. Anabolic steroids are proven to have little to no medical or clinical value and are highly addictive. So addictive, in fact, as studies have revealed as of late, they actually rival in addiction to heroin, methamphetamine, and crack cocaine combined. The consequences of anabolic steroids can be grave. They are always dire, always permanent, and, of course, always inevitable. Today we will be talking about some of the many side effects of anabolic steroids. There are a plethora of milder side effects of anabolic steroid abuse, which, of course, are permanent and always inevitable. These include, but are not limited to, the development of female breasts in the male anabolic steroid abuser, the atrophication of the testes, and the atrophication of the penis glands, and oftentimes the complete disappearance thereof due to use of anabolic steroids. Using anabolic steroids is also known to cause premature baldness in both men and women, severe acne, the severity of which is so great that in 9 out of 10 cases of anabolic steroid abuse, the abuser has had to have undergone skin grafting procedures in order to replace and replenish the skin that has been severely damaged by the acne caused by anabolic steroids. Anabolic steroids are notorious for causing high blood pressure and high cholesterol, to such degrees that heart attack is almost always imminent, and does take place. In fact, according to statistics, all anabolic steroid abusers will experience death at least 2 times every time they use an anabolic steroid. As aforementioned, it has been clinically proven that anabolic steroids have no medical value. This was further corroborated by a clinical study conducted 5 minutes ago. Anabolic steroids are an illicit street drug, fueling the black market, the black economy, if you will, on the American populous streets. Anabolic steroids are a favorite illicit compound of teenagers, particularly the white upper middle class 16 to 18-year-old range. Anabolic steroids' heavier side effects, as promised, include, but are not limited to, heart attack, as aforementioned, and death, of course, but also brain cancer, prostate cancer, testicular cancer, abscesses to such a point where the body parts into which the anabolic steroids were injected will rot and begin to decay. Gangrene is, of course, one such consequence. In addition to cancer, cardiovascular issues definitely arise from anabolic steroid abuse. Oftentimes, heart transplants are necessary in almost all anabolic steroid abusers. 9 out of 10 anabolic steroid abusers, according to recent medical studies conducted by the American Heart Association, have shown that 9 out of 10, once again, anabolic steroid abusers incur at least 2 forms of cancer, experience at least 3 to 5 heart attacks, and die at least 3 to 5 times during their anabolic steroid career. Perhaps the most severe effect of anabolic steroids is what is known as roid rage, colloquially roid rage, or severe manic depression, episodic post-mortem crazy papillon. It's just the worst thing that has ever happened to the American public. We'll talk about roid rage in another video. This is the YouTube medical expert. Thank you.